Thank you everyone for joining us today. I am excited and really honored to have Max Chua here today. He's an electronics and electrical engineer by training, a graduate of the University of Surrey in the United Kingdom, and he has over 17 years of experience in the industry. He spent the first 10 years of his career in the semiconductor industry, and after that, held a position as head of marketing and strategy for Asia Pacific in several global foreign multinational corporations. He's trained in electromagnetic field radiation health and safety issues for workplace and for products as well. And his personal health made him study the effects of wireless radiation on the human body. He founded Choizya, which specializes in detection and protection of wireless radiation from overexposure to wireless radiation. He's going to tell us all about his organization, what he's doing, what's happening in Singapore. He's spoken to numerous organizations and multinational corporations, including Sony Asia Pacific, Global Foundries, and the Young President Association of Malaysia. And I am so thankful to have you here today to join us and answer questions.
Yeah, thank you, Theodora.
So tell us what got you started on the issue of electromagnetic radiation, coming from the engineering background.
Yeah, I think my journey started off with my own personal health. Even I was trained in electronic and electrical engineering. I mean, during our school times, the effects of EMF on human body was never a subject of focus during the school times. So how it happens to me is, it started off with just a simple neck ache, and subsequently it progresses to my back. And so it got me having a problem that I'm not able to sleep properly. And it doesn't stop that, and it actually deteriorates further that I developed insomnia. And during that period of time, I thought that it was actually due to my work stress, or is it due to the aging factor, and so on and so forth. And then suddenly, one night, one of the evening, I stumbled across while I was Googling around and articles on how EMF actually can impact human health, caught my attention. And the more I study into it, the more I find that it's really amazed me with the amount of credible evidence out there. So being an engineers by training, we like to do a lot of experiments just to make sure that things can be reproducible, and it can be things that we can ascertain. So I did an experiment to keep my daily exposure surrounding me low, like taking care of all my wireless exposure particularly. And then, without long, I realized that actually there are 2 cell phone towers just located diagonally across my master bedroom, my bedroom. So after knowing that with the detectors, I started to explore into solution how to actually mitigate it, how to reduce the impact. Of course, then I gradually learn about shielding, how to shield against RF and so on and so forth. I implemented the solution in my own sleeping areas, and before long, my sleep improved, and my body ache started. All the symptoms about body ache started to go away, and I'm really surprised with the results. And before long, I tried to share with many people. And of course, people are never heard of such things, but that's actually got me started, and I feel that this is something that definitely I hope to share with more people in this part of the world, in Asia, where people are not so well informed or aware of the EMF overexposure risk. Yeah. So this is actually how it got me started.
So what is happening in Singapore and in nearby countries in Asia related to this issue? It sounds like it was very new when you first learned about it. Is there awareness on the issue?
Yeah, I think the awareness is very low. Of course, there are of course, Singapore being a a country that has many expat living here. The expat community tends to be a little bit more open with regards to this EMF, probably because of their awareness back in the countries. But country like our locals are particularly not interested in it, or have not even heard of that. So you know, you'll be very surprised that, you know, Singapore what is actually happening over the last couple of short decades, you can call it. You know, Singapore having been a population of only 5.7 million, but over the last couple of short decades, maybe 20, 30 years, you know, in the local news, there have been reported many incidents of sudden increase in health issues, especially for example, diabetes. Diabetes has been on the huge increase in Singapore, and you'll be very, very surprised. Singapore is only just behind America in terms of the highest proportion of diabetic. Yeah. So you know, US being 300 million population, and Singapore is only 5.7. So it's a huge thing over here, and the government is so concerned that they declare that they're going to have a war against the diabetes in Singapore. And of course, the other aspect is autism. Singapore also has you know, one of the highest rate of autism compared to the rest of the world. According to the, you know, the figure, I mean, globally speaking, is about one in 160 people, but Singapore is 1 in 150. Yeah, so it is rather high compared to the global norm. Fertility male also in the rise as far as male fertility in Singapore is concerned. Of course, cancer is also very, very, you know, common here. One in 4 people probably will develop cancer in their lifetime in Singapore. And dementia is getting even more serious, because 1 in 10 people above the age of 60 will suffer from dementia. And what is actually captured a lot of media attention lately is a rise in the numbers of young onset dementia. So it was very, very you know, surprise to many that, you know, people that under around 40 years old can get this kind of thing. And of course, EHS, electro hypersensitivity, is also very common here. It's just that people in Singapore or in this part of the world, in ASEAN or in Southeast Asia, many of them experience this kind of symptoms, but they have no way or do not know where to actually get it properly diagnosed or where to seek help, medical help, because essentially here we don't have much expertise in this area. And I think the other thing that actually, what I would say that as far as Singapore is concerned, you know, Singapore is highly, quite developed in a way. You know, people might not know that Singapore has the largest concentration of subsea cable in Asia. And this offers very excellent connectivity to the rest of the world. And that, because of that, there are many data centers that's been built in Singapore. Just such a tiny nation, we have 60 over, you know, data centers. And because of that, you know, Singapore is also, you know, doing multiple projects like smart city projects. We are into 5G. We already deployed 5G. The government is into AI, Internet of Things. You know, anything that is, you know, I think it is similar probably in America, going to electric cars, digital payments, so on and so forth. So as far as this is concerned, I think Singapore is among the few countries in Asia that is leading the 5G deployment. Obviously, China, South Korea, Taiwan, and Japan is among them as well. So yeah, so this is what actually happening with regards to 5G deployment over here. And I think the government has planned to roll it out to have an island nationwide coverage by 2025. It started by the year of end 2020. So right now it's about half of the coverage. They plan to be able to complete that by 2022. That's next year. So yeah, by 25, in just a couple of years' time, they want to have a nationwide coverage. So yeah, 5G. Similarly, yeah, 5G, yeah, exactly. And similarly for smart meter deployment, it started back in September 2019, and their plan is to fully install with all the whole country to have this smart meter by 2024. So there's all some of these things that Singapore is moving towards. Yeah, you can see that, you know, 5G, all this highly electrification and all this, you know. But among many other ASEAN countries are also developing their own deployment with 5G. They have just started it. Probably it will take some time. Maybe many of them actually are targeting until early 2022, perhaps. Right now with the COVID, I'm not too sure whether it will stall some of this plan or not. But majority of these countries in Southeast Asia, they are still in the midst of actually massively deployment of this 4G in infrastructure, because many of these are not highly penetrated yet as far as 4G is concerned. So there's still a lot of areas for them to actually do that. So that having said that, that means that there's a lot of things going on here, and Singapore right now, as far as Singapore is concerned, we are already we have 3G, 4G, and 5G right now, all happening at the same time. I think a couple of years back, I think we stopped 2G. So right now you can see that these are the three generation of mobile communication technologies. Yeah. So this is just briefly talk about what Singapore and Southeast Asia is doing with regards to EMF pollution.
So it's ramping up in Singapore just as everywhere else in the world. Well, tell me two things. One is you mentioned early onset dementia increasing. We're noticing that here too. Our Blue Cross Blue Shield came out with a report. That's one of our biggest insurance companies. And they're finding that early onset dementia is rapidly escalating and has been. And of course, the issue of wireless impacts to the brain have not been adequately even reviewed, certainly by the United States or any health and safety agency of a federal government that I know of has fully looked at that and ensured safety for people. But tell me about stories. You are helping people in their homes. You give talks about wireless radiation and what equipment can protect people for those people who are interested. Can you give me some examples of how you've helped people in your community and what you're seeing on the ground?
Yeah, I think like what you have mentioned, what I'm doing, my job itself entails, to help people to actually, to assess their level of exposure. And during assessment, we will give some recommendation. What are the things that they can do, in the event that they are having high exposure? What are some of the things that they can do? For example, we are the things probably we have covered numerous times already in this talk. Like for example, there are things that we advise people, like in the principle of just keeping a safe distance. The further the better. We call, I heard many times that the word is mentioning like distance is your friend. We help them to give them this kind of information with regards to help them in terms of their house to use LAN cable, Ethernet cable as much as possible, even though it is not, many people doesn't want to do that, but with the detector itself or the meter itself, we will show them how high they are being exposed to their nearby routers compared to a LAN cable kind of solution. Often than not, they'll be very surprised to see how high the radiation goes up, and if they are fully connected, how the levels actually just gone out to the very low level. These are some of the things we also give some consultation in terms of how actually they can use their device in a more safer way, in a way that we encourage them to use cable as much as possible. For example, instead of using Bluetooth or wireless speakers, we will ask them to cable up. Or in the phone, I always used to tell them that you have a phone, there are multiple antennas in your phone. When you're not using some of this function, try to deactivate it. It will help to reduce the level as well. And of course, I have also just mentioned that in terms of if they are being exposed to high external RF sources, most of the time that we will provide some solution in terms of shielding, how to block it. Yeah. So these are things that we do. And besides doing that, earlier on you had mentioned that I've been giving talks as well, and also supporting some other organization when they want to organize some health talk. I'm also supporting them in that regards, doing some private talks to some schools or some business social groups. I also give some free consultation for people that are very concerned with EMF issues, and also working together with some alternative health practitioners here in Singapore. for those people that might be facing some health issue related to EMF. So that's where we come in to go to actually assess their environment and see what are the issue here. Yeah. So these are some of the things that I've been doing in order to help people in this regards.
I've seen you on the news, and you've been making, the word is getting out from the work that you've done incredibly in your community. So you're really making a difference. I see that. I mean, getting the news to cover what you're doing and getting yourself, so that people can hear what you're talking about is very important.
Yeah, I think what really give me the confidence is that when we started to share some, because I do have clients who are those specialists, medical specialists. For some of them are ENT specialists, and they are from different fields. So they are quite open to the idea of EMF impact on health. And the moment that I started to share with them a lot of information. In fact, I took a lot of information from Environmental Health Trust, which is a very good library or resource area that forward a lot of good information for this group of professionals. And I'm very pleased that they started to see this very differently, because they have never been exposed to this kind of information, or they do not know where to actually find credible information to help them. Because even in their scope of work, they also have their colleagues. Sometimes they do share things with their colleagues, and obviously a lot of times they are not able to pull out strong information in order to support their belief. Yeah. So this is what I've been doing. I feel that there are quite a good number of professionals are very open to this, and I'm trying to influence them in the way that giving them a lot of credible scientific evidence to give them more confidence in what is this whole EMF thing. Yeah.
Right. The first thing people say is, well, show me the science, or what, where is the background for that? And of course there is a ever mounting body of science, but people often don't have that information at their fingertips.
Exactly.
That's so important to understand that this is substantiated by published science, which has shown effects in numerous studies, not just a handful, but many.
But what I find that what is very compelling and very for me to actually even to engage the conversation is actually the current ongoing case with EHT doing it with FFCC, because it really surprises them that even they can end up in this kind of cases, and it turned out to be very well. So they are very surprised that with such an EHT body, there are somebody that's able to even challenge up to FCC. So that actually caught a lot of attention. And I think that is definitely a very positive steps, to open up even the conversation.
Yeah, well, we're very thankful about this ruling. I mean, I think people might look to the United States and to the FCC as being, what the truth or ensuring safety. But our case shows that the FCC was unable to defend its limits, that they had ignored all of this science, and they hadn't explained why they had ignored it. This was a procedural case. It was about the review, the adequate review. Was the issue adequately reviewed? And what we showed is that it has not. But our situation in the United States is similar to many countries where there has been no robust review of the full body of science. It simply hasn't been adequately done. And we're thankful for this. And as you know, we're moving on to our the next action that needs to happen here in the United States, which is now to ensure that our federal agencies do the proper review. And we are going to hold their feet to the fire, so to say. We're going to make sure that, keep it in the public eye, keep it transparent, and ensure that they do an environmental review. And of course, that includes a review of human health impacts. But speaking of that issue, what do you see as what the government in Singapore needs to do in relation to electromagnetic fields?
Yeah, I feel that, you know, this is something that, you know, I feel that the government here should be more open, encourage open debates and discussion on EMF topics, because there isn't such things going on here. I hope that they are more open and willing to listen to science. Yeah, so, you know, instead of just probably similar to many countries, I think it's quite easy and convenient to just take information or follow the direction of IGNEP or the WHO. I think this is what in multiple times that, you know, even in Singapore, that you know, they are always cited everything, they just point back to IGNEP and the WHO. So this is, I hope that they are willing to open up to listen to another the science, that why this guideline established by these two bodies is totally unprotective. Yeah. So, and I hope that they will start to actually do some real and meaningful experiment on long-term health effect of EMF exposure, because I cannot see that in the WHO EMF project. You know, Singapore has submitted a couple of reports, but I didn't see that they are really engaging in a very meaningful kind of experiment. I hope that they will do that to do in-depth studies with regards to this, especially in terms of their own study, yeah, independent studies. And sometimes it could be even a joint experiment with other countries, yeah, because this is quite a big complex subject. So, you know, I hope that they can do that. And you know, with regards to seeing what is actually is more on the day-to-day kind of issue, because you know, in Singapore there are many mobile phone masts or antennas being you know, erected up in many places. Some of them are actually in a very close vicinities where public have a constant contact with it. It could be just on the lamppost that is very near to. So I hope that they can even do something to warn the public, give a buffer zone or warning labels that this, you know, this is totally not you know, been established. Here I can even see that they put it on the pavement there. It's just a small thing, and children can just be walking beside this kind of antenna. It's really quite you know, disheartening to see that with such a kind of exposure, you know, that they can potentially pull people into, and there's no warning or stuff like this. So these are things that I hope that the government can do. And instead of just focusing, I think they are, of course, economy is a very important thing for many countries, but I hope that they can also be open to really consider the public health aspect of it. Just now, I've already mentioned that you know, in the short decades, we already see many of these health issues from diabetes and so and so forth. There are, in such a short period of time, there are so many, and constantly we are hearing. Prior to COVID, in Singapore media, we always hear about, you know, talking about all those health issues. We're going to address this. It's getting worse and things like that. So I hope that it's time for them to actually, you know, take that as a warning sign, you know, and started to look into this and stop disregarding anything to do with EMF, because, you know, start to be more open and really, you know, study this. Yeah. So this is what I hope, and the other aspect of it is that, you know, I also hope that you know, not so much on the government side, but I hope that, you know, probably in this part of the world, in Singapore, in Asia, probably at some point in time we will have you know, able to establish some good enough EMF kind of support group over here, whether in what kind of form, yeah, you know, so that it can promote better in terms of the you know, the EMF awareness, by setting up conferences or seminars locally or regionally. I think that will help, you know, in a way to establish some you know, the ability to share something with the government in a small way. Yeah. So yeah, so this is how I find that it might help the government over here.
Are physicians educated on this issue? Is there a growing group of physicians who can help treat people? And
Unfortunately not. There are groups of alternative medical practitioners like naturopathic doctors, nutritionists who are very concerned into the aspect. But in order to diagnose for those areas that we talk about, diagnose and have proper diagnosis, test, and how to treat it, is still a big gap over here. I've attended several other medical conferences here, and I'm surprised to hear there are a couple of these alternative, or they call it functional practitioner, mention about EMF. But as far as they are aware of the potential health risks, but how to actually go about to really do the kind of diagnosis and treatment is not really there compared to US or in Europe. They have all the specialists that is able to do that. So there is definitely a huge gap in terms of the ability to do the kind of treatment here in Singapore. That is why I have many clients who are EHS themselves. They are very sensitive to EMF, and they always told me that they have no recourse. They have no medical recourse to find ways to help them, because essentially they are not able to find anything here. Yeah.
Right. That's why I'm so thankful about the EMF Medical Conference, which is available as training for medical doctors to get their continuing education credits. And I hope that that can be shared. Those are online, so that is a resource. And I would absolutely love for you to move forward with webinars or conferences where you can bring experts to your community so that people can learn and get educated.
Yeah.
Are there any scientists in Singapore who are working on this issue independently?
Not to my knowledge. Not to my knowledge that they are doing a very comprehensive independent studies. Not to my knowledge.
And we've talked about this when we talked in the past, but there was a time when the Singapore government website said very specifically to keep the phone away from the head. And that has mysteriously recently disappeared.
Yes.
So the government no longer recommends keep the phone away from your head, or is there any public health information?
No, there isn't. Yeah, you're right. I mean, I also keep a snapshot of that statement. Actually, it's from NEA, National Environmental Agency. They did state that. Yeah, I still keep a snapshot. Right. So during my presentation, I used to share with people. But now, if you go to the website, it has been revamped. You can't see such statement around. I'm not too sure what is the reason. Yeah, So that is in fact, in short, that information is no longer there. Yeah, you're right.
The magically disappearing public health information on cell phones. I mean, not funny at all, actually, but it's happening all over. It happened in the United States in so many government agencies. Most recently, the National Toxicology Program actually changed its text mysteriously. The United Kingdom, completely hidden. It's actually still there, but they've removed a lot of the places where that information was. However, we do have the California Department of Health, the Connecticut Department of Health, and actually the North Carolina Department of Health, which have put this information up online. The CDC removed recommendations that it had short-lived. I mean, we don't have the forward-thinking, prudent policy, the public health recommendations that the public deserves, so that they know not to keep devices close to their body. And also at the federal level, we need to have reductions in this increasing environmental exposure. So you're telling me that they are putting out 5G with antennas close to homes. I'm assuming in urban areas, you have those antennas close to apartment buildings where there's line of sight of antennas. Is that legal?
So far, they have actually not really putting, it's quite different compared to the US where they actually put the 5G near just outside the lamppost. I think it's very, very close. So what is actually currently deployed in many places across Singapore is actually the typical 5G, but it's on top of the building. It's still some distance away. They are not really going to that kind of close proximity. I guess it has something to do with the the speed itself, because in Singapore for 5G, as in many countries, there are users of three band. One is 3.5 gigahertz, one is 26, and the other one is 28 gigahertz. So a lot of things that you can see deployed right now in Singapore, they are still using the 3.5 gigahertz, which means that actually they are able to actually put their cell phone tower further away, because it's a lower frequency, they can actually travel further. So they are not those like operating at 26 or 28 kind of thing that you really need to put it very close to
right.
to usage. Yeah.
Right. Well, that's interesting. I'm sure it was only a matter of time.
Yeah.
And please put your questions in the Q&A. I am keeping note of those questions. I guess one question that someone has asked is, what are there groups in Singapore and in Asia that are working on this issue, advocating for more protections?
I'm not too, for example, in Singapore, I'm not too sure about Southeast Asia, but in Singapore, there are a lot of individuals, probably they have write petition when they see that there's a 5G summit or things like that to stop 5G, all this kind of movement. They have gathered together to write some petition, but that's about it. After a while, it quietens down or it cool down. There's not really a body or groups that are actually doing this actively. So yeah, so this is what I see in Singapore.
So is that happening? Are people starting to get motivated to come together with this enhanced deployment of these new antennas that you're seeing in the country? Do you foresee that as happening, or is there a chill on the conversation?
I guess there's a chill. Actually, at one point in time, it caught a lot of attention. When the media, for example, we know that from YouTube, we hear that a lot of people are stopping 5G, or they even burn 5G cell phone towers and things like that. Actually, at one point in time, it caught a lot of people's attention, like why are other countries doing that? And then it seems that there's a lot of interest in following up with 5G. But right now, I think with the events of COVID, everything just be overshadowed by this event, and nobody actually right now talks about 5G. Again, as I said, in majority, but I do have people that is because of health or because of all this kind of reason, they are always into this. So there are still a group of people that are always constantly interested in this subject. But I guess the huge majority of the people are just not, taking this, seriously.
Yeah. So we have a lot of work to do.
Yeah.
To raise this issue. Does Singapore use FCC limits or ICNIRP limits, or do you have your own?
Singapore uses ICNIRP.
Yeah. And are there any rules on phones? Like when you buy a phone, are you informed, like you are in France or in other countries, that the phone shouldn't be touching your body? Or are you informed about SAR at all?
No. That's a very, very good question. When in my early part, when I started to get myself involved in this thing, when I learned about, in your phone, you got this warning message, telling people, not to put it too close to you. Very interestingly, right now, if you go to I'm not too sure whether is this happening to other countries' mobile phone as well, but at least in Singapore, some of the latest phone that you find in the shelf, a lot of this information has been, like what you say, mysteriously disappeared. Yeah, warning people about this, or it becomes even harder to even find it. So I think there's a deliberate kind of thing that they are trying to do, because in the past it's always very easy. I just tell them these are the places, just go and find it. Whether is it iPhone or is it Samsung model, I can tell you where to go and find it. But right now it becomes harder and harder to actually find those warnings. Yeah. So as far as labor is concerned, to warn public about, especially the children, about this, there is no such warning.
Right. Interesting, because in France, people are warned to keep it away from the abdomen of pregnant women and teenagers, it states, to keep it away from the abdomen of teenagers' phones. And now they're going to beginning to test they want all wireless devices, including laptops and computers and tablets and Wi-Fi speakers and everything, just to be tested as they do and under the same regulations as cell phones, which France has among the most strictest and most transparent rules. They have a way to go, but compared to other countries, they're light years ahead, like in the United States, where everyone just puts the phone to their head, in their bra, or in their pants pocket, or right against their reproductive organs on their lap. That's just common. And nobody is informing them otherwise. Apple, you know, I don't know if you read the op-ed that I did about Apple, but they have online information about radio frequency radiation, and they literally changed their text going back a few years, which inform people to keep the device away. And they changed the wording so that if you didn't know what it was saying, you wouldn't understand that that is what it was saying. It's been changed. So, wow. we have a lot of similar issues are happening all around the country.
It's a global issue, yeah. So actually, we are facing it similarly. Yeah, it's just that, you know, here, you know, I believe that with the ability to, let's say, for example, in future, if let's say there's a possibility of creating all this thing more talks between the expert, I also believe that probably you have to influence at the kind of professional level, yeah, and slowly it will trickle down, because, you know, if you to do this concerning to the public, that's how much actually we can do, the amount of times that we do the public talk, that's all. But always going into the authority kind of setting, doing in the professional medical kind, slowly how to influence that. And I think that probably will, in my opinion, probably will resonate even, you know, having a better kind of results, because once the medical and all these people get to know about it, you know, they will actually started to advise their patient and things like that. And then, you know, patient definitely have a huge trust, you know, with their medical doctor and so on and so forth. So I think even for this kind of a medical profession, they are able to, if let's say they find that the evidence are compelling, they have the ability to bring up this topic to their peers, and actually through their communities, they are able to do something. So that's how I feel that it can slowly, you know, have the cascading or you know, the effect, yeah, to slowly spread it up. Yeah, well, I think just now you mentioned also about the France thing. I think the at one point it was actually quite well covered because of the phone gate issue. The phone gate, I think it was an excellent thing. It's just that here after a while, it just, you know, disappeared. There's no continual. I think that the key thing is that how to keep certain kind of messaging or certain information at a constant kind, because people need to be constantly reminded. If you say that for a while, they just, you know, easily forget about this thing. And if you don't, especially in Singapore, this kind of news don't come regularly. Yeah, so people tend to forget it or don't really take it very, very seriously. So that's why I'm seeing that in Singapore, there is no constant kind of information or kind of things that people can, yeah.
It's interesting because it seems like people, if something is not in front of their face every second, they don't think it's real. It might have been last year, but yes, if they don't see it again, they think, oh, well, that just went away. It didn't go anywhere. The science went nowhere. The science is the science. The phones are only getting more powerful. Well, and I would think in such a technologically advanced country that, you know, beginning to look at having your elected officials and the public realize that you're adopting limits from ICNIRP, which is a 13, 14 member, no oversight group that has a very fancy name, but has no oversight at all. And it's an invite-only club. And it's not, they have not looked at all of the research in a vetted, peer-reviewed way. They continue to say that heating is the only harm. They have a handful of animal studies that they base their limits on. I think if people realize this, but in order to realize it, they have to take the time, and there has to be coverage of the issue in a way that is understandable and not confusing. So I had a question that someone asked, which is, are people being accommodated in their workplace or in schools for this issue?
Accommodated as in the sense that if they are sensitive to EMF or what?
Yes, if they are sensitive to EMFs, are they able to have their workplace changes so that they are not overexposed, or is it considered, do they have to leave their jobs? Are there any accommodations happening?
really, that is a unfortunate thing, that because I do have many clients who are unfortunately sensitive to this, and from the conversation with these people, they always will tell you it's either they'll keep this secret, that their colleagues will not know that actually they are sensitive, just fearing of the job, the security of job. So actually they do not let people know that they are. So and that's from the EHS in individuals. As far as whether there's a place, whether they have rights, or whether they are being treated with respect, or there isn't, because like I did mention that in the medical field, they don't even acknowledge things like EHS. Of course, coming back to the same thing, they always will mention that it is something in your brain, you're imagining things, it is not a real thing happening. The other thing that I have to say, that it is the confusing statement from WHO as well. If you go to WHO website, you can feel that they do say something about EHS. Yeah, they sort of like recognizing EHS, and sometimes along the way when you read it, they sort of like, again, giving this kind of confusing statement where like yes or no. So people are highly being confused by this kind of statement. So with that being said, in a workplace or whatever, they have no people don't really give these people a kind of a safe environment for them to actually work, because for them they think that this is not real. Yeah.
Right.
And there's no regulations, they always thought there's no regulation, that this is not a sickness, this is not a recognized thing, they disrespect the fact that information about other countries that recognize this even as a disability. But here it's because they never heard of medically, these people are not trained, and because of all this the background of not able to see this EHS as a real health issues, they actually just ignore it.
Same story then, same story happening around the world, although there are people who are being accommodated, and there are countries where there have been many lawsuits won where people have been able to get accommodated. So this is changing for sure. And let's talk about the WHO for a minute. I just got an email and continue. We get emails all the time from people around the world saying, how can you say there's a problem when the World Health Organization says there is no problem? On their fact sheets online, it says that there's been a review and there's no problem. But what people don't know is that actually the fact sheets that are online at the WHO are part of the EMF project. The EMF project is totally separate from the International Agency for Research on Cancer of the World Health Organization, which found and classified radio frequency as a possible carcinogen in 211, and has been advised to relook at that. They haven't met together to look at it yet, but they've been advised to do that within the next few years. But that's separate from those fact sheets. Those fact sheets are written by, as far as we know, one person. That EMF project was funded with industry money through, Michael Rapiccioli, who's now seems to be an industry consultant. And those fact sheets, according to the scientist himself in talks he gave in India, which you can go online to our website under the WHO part, where you can see him say that he wrote those fact sheets years ago, and maybe they are updating them, but not based on any review. There has been no peer review, published review by the EMF project since 1993, according to the WHO. So just like with our lawsuit, where we called out the proper review, we said, where is the review? Where are you showing that you looked at everything in a reasoned way? And the FCC was unable to show it. We have been writing Dr. Van Deventer of the WHO EMF project, and we have that on our website for everyone on the call, everyone who's listening. It is posted on our website that those questions have been unanswered. Top scientists have asked, how did you write the fact sheets? What is it based on? How are you putting together your groups for an upcoming review, which they are putting together? They are now putting together a review, but how they chose those scientists remains undisclosed, no transparency. In fact, many of them have long-standing industry ties. So here we are again. But the WHO fact sheets are not based on a full review by independent scientists. And it's sad that it's online because everyone thinks it's.
Exactly.
Yeah. So.
Yeah, exactly. I mean, IRAC say one thing which is under their umbrella, but WHO came out to put in another statement which is very, very conflicting because, and for a lot of people that's not trained to even know that there's an IRAC exists, they only look at WHO because that's what majority of people know. So every time you have to put in IRAC, they say, what is IRAC, for example, yeah? But they didn't know this is an organization that, yeah. So again, it creates a lot of confusion, and that's why a lot of people just simply just say, WHO say it's fine, yeah. But, you know,
I know, because we want to believe it. I wanted to believe it. And that is how the wireless industry has been successful, is creating doubt and capturing the agencies that the public respect. You know, the credible, considered credible agencies are just putting forward industry information and statements which are not backed by a proper independent review. A lot of work that needs to be done to showcase that, and I'm thankful that you're doing work in your community. So in the Q&A, there is a question: are there required measurements having to do with the fine print warnings for laptops and other equipment like Wi-Fi routers? I can answer that too, but let me ask you, what you, in your community or in Singapore, does the government require that people are informed about the fine print warning on laptops? Like my laptop says 20 centimeters. If you search and search and search, actually, it actually says 20 centimeters is what it's supposed to be from the body.
I'm not made aware that there are such statement from the government to inform the public about reading this in a fine print, or whether is it from the manufacturer who says that it should be. Obviously the manufacturer will not say that, but I'm just saying that as far as the government is concerned, there is no information that been disseminated to the public to say that please look into the warning or the fine print and things like that. No. Yeah.
Well, so like a wife, like when I went to my dad's house, he had the Wi-Fi router, the Wi-Fi printer, and his Wi-Fi computer all on this L desk, literally touching his body. The printer was probably less than an inch from his body. Wow. Less than an inch. I mean, and it was, of course, transmitting all the time. I mean, I had my measuring and I started turning everything off and testing, and completely unaware, which is typical in the United States. Is that what you're seeing?
Yes, it's the same thing here in Singapore. It's exactly the same thing. Yeah. Yeah, you constantly, because there are many places, houses that I've been to, or organization, it's always the same thing. Yeah, same thing, because they have totally no idea about these devices, because all this emission is invisible. Yeah, they cannot until their body feels something. But before that, they are all. And right now, with this COVID situation, many people are being forced to work at home. For example, right now, their exposure are even greater because they continue to work with their environment with all this wireless connectivity. In the past, in their workspace, they're still able to move around. And it depends on where they sit. Sometimes they might not be exposing with the greatest, levels of EMF from their workplace, depending on where the router is. Sometimes they might not expose so great. But back in our home, people, they, like what you mentioned, the printer, wireless printer is here everywhere. They have a router, they have a wireless speaker, they have all this kind of thing. They have a wireless Bluetooth doing all this kind of thing. And then when we do the assessment and when we show them, people, they need to actually visually see it, because these are things that's invisible, that they will not comprehend. Yeah. So once they see the level, at least they started to visualize, oh, this is what you mean by high. Or this is when you turn off, this is what you mean by exactly low. When I tell you mean that when I cable it, when I do all this kind of thing, it's really that low. Or when you activate everything, then they start to see, wow, why the radiation goes up all the way. And this has a very high impact, when people see visually. So in my course of my presentation or style sharing, I do try to do a lot of demos just to show them. I think probably I've seen a few demos that you have done in your talk as well. I think these are very, very powerful things when they can see themselves. And I was actually even also thinking that, that there's a lot of well taught, maybe a clever thought of demo. I think demonstration is very powerful. Yeah, talking a lot of words people might not be. So of course the visual simulation is very powerful, and of course simple demonstration. Even for example, if we cannot do a kind of simulation with a human or whatever, you can actually mimic. For example, it's just my thought. That's just like a fake skin or a piece of meat or whatever kind of thing that you can actually hold it behind it, and you have a radiation, and then you see a simple thing that can show the people that then it actually penetrate how did it inside, and this meter actually pick it up from there, something that is very real and something that they can feel. So I think that probably some, I always believe that, maybe because of being an engineer by training, I feel that a lot of this kind of thing, when people see it, is very, very powerful. Yeah.
Yes, it is making the invisible visible, because
Correct.
Because you can't see it. It's very easy, because we don't want to believe this could be a
Correct. The
problem.
inconvenience, yeah. Many people feel it's so inconvenience to their life and things like that. Yeah.
Yeah, that's why we're so thankful for the work. We have been collaborating with engineers from Brazil on their work. I did an interview with Sergio Rancini, you can watch online, and Claudio Fernandez and Alvaro de Sales, who are engineers, have been long worked on modeling, simulating the electric field inside the body from an outside source. So you can really see this wireless radiation penetrates, it is absorbed into our bodies, and our bodies then have fields in our bodies from the emissions from this device that you're holding in your hand, the cell phone, the router, the wireless speaker, the Bluetooth headsets. These new Bluetooth can be very high, they're higher powered Bluetooth. There's different classes of them, and part of the brain is being exposed all the time if you wear it all the time, but people are completely unaware because they can't see it. So that is an important piece of the work. I hope that you're using and showcasing the modeling done by the work of the engineers in Brazil, and which has been published in several papers, that shows a child and an adult.
I've seen that, yeah.
And the laptops on the lap, it's going into the abdomen. I mean, I certainly had that laptop on my lap all the time for hours and hours. And now these kids in college or kids in high school are sleeping with these devices, several devices on their body, completely unaware.
Correct. Like I say, that it's invisible, their body can't feel it, so they don't really take it very, very seriously, because it's only until they see or until their body started to react or feel something. But that's probably too late. Yeah.
We just got a call from a brain surgeon who we've never talked to before, out of the blue, telling us they have not seen so many pediatric brain cancer cases as they're seeing now. And could we please send the top information that we have on cancer and cell phone radiation so that they can begin to learn about the issue? We had an annual report to the nation in the United States with the American Cancer Society, the CDC, the National Cancer Institute, and others, puts together the cancer statistics. And there are rises in cancer in our youth that are being documented, increasing trends. This is happening. We are seeing increases in the United States, and we need to look at that instead of just writing it off. So,
yeah, I've seen somewhere, I think, or heard some of the studies going on concerning about the increase of children having all this or this cancer in the probably has to do with how they carry their phone on their back of their pockets. There seems to be have an increase of cancer rate among young children in a particular part of their body, in the lower part of the body. I'm not too sure whether that is the case.
Well, we are seeing a staggering over 3 times rate of colorectal cancer.
Colorectal cancer, yeah.
In people who are in their 20s and 30s, who should not be. This is It's unprecedented and it needs to be addressed. Now, obviously we have pesticides, we have a lot more toxic environment in general, but the research has also shown links between that combined exposure. What does that mean when you have a phone in your pocket and that is being absorbed all over? How does that affect the toxins that we already have in our body, or those increased toxins we have from our food and water and air? That needs to be addressed. Before we go, could you tell people how to get in touch with you? The website, your organization's website, and any other information where they can learn more about what you're doing in Singapore. That would be great.
Okay, my website is just www.choizya.com. Yeah.
Thank you so much for joining us, and we will be editing this and getting it out for everyone to watch and share, and I appreciate you taking the time to talk with us in your evening and our morning here in the United States.
Thank you very much, Theodora, for having me.
Thank you.
Thank you.